Savior, take my all is thine.
It's never too early
It's never too late
to become the healthiest you. Gusto ka bala makabalo paano mas matipanan ang imulawas sang maayo?
Ukon makakuha impormasyon na hanungod sa mga sakit,
Kag mahatagan dugang nga kaalam sa mga butang na hanungod sa aton lawas?
tutok na diri sa The Voice of Health
Ang tingog nga mabulig.
para ikaw mas maging mapagros kag malipayon.
Kada Lunes,
As 11 hasta alas 12 sang ugto.
The Voice of Health. Sharing the healing ministry to all beyond words.
Brought to you by the Adventist Medical Center, Bacolod.
Happy Monday and happy morning mga kapaglaom. Isa na naman katopko ang aton pag-aistoryahan na hanungod sa maayong panlawas. Welcome to the Voice of Health, trumpeting heaven's prescription that lifestyle is medicine. Kag kami ang inyo mangin kaupod sini nga aga, ako si kapaglaom Marvin.
Kag happy morning mga kapaglaom, ako gali si kapaglaom ninyo. Matanaw kita live sa Facebook page or Facebook page sang YouTube kag YouTube channel sang Hope Channel Bacolod kag Adventist Medical Center Bacolod kag sa Facebook page sang Hope Channel Philippines, Hope Channel Center Philippines, AWR 360 Bacolod and Negros Occidental Conference.
Kag bago kita magapadayon sa aton nga programa,
Yes.
akon gina-imbitar ang tanan sa aton opening prayer. Let us pray. Sa imo, O Diyos, nga yara ka sa mga kaitaas-taasan sa mga langit, ang pagdayaw, paghimaya, kag pagpasalamat, amon ginabalik gidira sa imo. Salamat Ginoo sa isa naman kaadlaw, kag isa ka tion nga ginhatag mo sa amon, sa diin kami naman may ara sang oportunidad nga makapamati sa mga topiko na hanungod sa maayong panlawas. Akon ginadala sa pagpangamuyo Ginoo ang amon invited speaker sa sini nga kaagahon nga ikaw magahatag sa iya sang langitnon nga kaalam para iya mapatpat ang ini nga topiko nga iya pagadalon subong nga aga. Subong man akon ginapangamuyo dira sa imo Ginoo nga ikaw magabless man sa tagsa ka mga tumalanaw, mga listeners sa sini nga programa nga kabay kami ang makakuha gid sa mga informative nga mga topic kag mga pagtulunan para ini ma-apply sa amon nga mga pagkabuhi sa adlaw-adlaw nga tanan. Patawara kami kung sa diin kami nakapasubo sa imo sa ngalan sa buhat kag sa panghuna-huna. Sa ngalan ni Ginoong Hesus, amon personal nga Dios kag manluluwas. Amen.
Amen.
All right. So once again, happy morning, happy Monday kapaglaom ninyo. Kumusta ka man subong nga aga?
Happy morning. Praise the Lord. Kay nabugtaw naman kita sa sining nga kagaon kag makita kagid kapaglaom Marvin niya, nalipay na gid ko.
Salamat man kapag laom ninyo kag
Yes.
nalipay man ko kapag laom ninyo nga ikaw subong ako na kaupod sini nga aga nga sini nga episode kay
Yes.
it's been few episodes na, or several episodes na ang aton nga napagwa diri sa The Voice of Health, but this is the first time nga magkaupod
Yes.
kita as tandem sa hosting sini nga programa.
Yes, kag I would like to grab this opportunity to greet you. Happy Father's Day.
All right. So thank you very much kapag laom ninyo.
Yes.
And of course, no, happy Father's Day
Happy
kahapon,
Father's Day.
no? And
Yes, kahapon.
so extended ang aton nga celebration up to
Yes.
today, no? So happy Father's Day sa tanan nga mga tatay kag mga father figures kapag laom ninyo,
Yes.
no? So kay ti maghambak kita Father's Day, it does not specifically refer lang sa aton nga mga tatay sa aton mga panimalay, no, but those father figures man nga naga-serve
Yes.
as tatay, no, sa ilatag sa ka mga pamilya. So once again, happy Father's Day sa mga tatay kag mga tatay figure.
Yes.
All right. So amon man ginagreet dira ang aton nga mga live viewers tumalanaw sini nga programa. Thank you for joining us this morning.
Yes, kag ginagreet gali namon ang aton mga technical staff nga gaupod permi sa aton si Brother Ivan kag ang iya mga crew no.
Si Brother Ayan.
Brother Ayan, I mean. Sagang aton nga mga family dira sa kay lain ng mga church nga ga tanaw sa aton. Kag aton nga mga patient dira sa Adventist Medical Center Bacolod, may gitanaw dira.
Wow,
No?
it's nice to know that kapag laom ninyo no sa mga patients sa Adventist Medical Center
Yes.
Bacolod. Wow, so that's nice to know. And of course, we want also to greet our Administrative Council no sang Adventist Medical Center Bacolod.
Yes.
Of course, ginapangunahan sang aton mapisan kag madinasigon nga presidente and medical director, Dr. Sherwin Lobe Rodrigo. Doc, happy morning.
Happy
And
morning.
yes, the rest of the Administrative Council, our department managers, and of course, tanan nga mga staff and aton nga mga empleyado dira sa BAMC, no, including our doctors, our nurses. No?
Yes.
Thank you for joining us and for watching this program.
Yes, gusto ko tani i-grab opportunity no to greet our renal care department nga mga nurses dira. So happy viewing sa inyo. Kaga ang amon nga Strings of Christ family. Yes.
And of course, kapag laom ninyo, no, so ang aton man nga mga sister institutions, they are also tuning in with us, no. Naga-join sila sa aton, no, sa diri sa Negros Occidental Conference, aton nga mga eskwelahan, no, aton nga mga Seventh-day Adventist nga mga church school. So I know that they are also watching this program, and happy morning to you, and thank you for supporting this program. Of course, kapag laom ninyo, no, aton gidya nga encourage ang aton nga mga FB Live and YouTube channel nga mga viewers to like, share, no? And kung
Yes.
wala pa nakasubscribe, subscribe now sa aton nga pages para nga every time mag-live ang ining nga programa, no, matagaan sila sa notification nga we are live na sa sining nga program. So again, gina-encourage ko ang tanan to share this episode for today.
Yes, kag always remember nga nationwide kita, no? So sa aton yung mga lain-lain yung mga
That's
nga
true.
country, no? So you can also send your message directly in our hotline. Amo ting atong hotline 0921-299-2122, or you can see it on the screen. Iwaton ko 0921-299-2122. You can send your prayer request, specifically aton nga prayer request. Kay we believe that more prayers, more powers.
Amen. Amen to that kapag
Yes.
laom ninyo. So, mula ning kanami bala kapag laom ninyo kay we have a lot of avenues nga pwede gid sila kapalabot sang ilang mga greetings,
Yes.
no? Ilang nga mga clarifications later on sa aton nga program and prayer request, no? May ara sa aton nga mga FB pages, and may ara man kita text line. So sa may mga challenges sa ilaya nga internet connection, you can reach us via the number that is flash on your screen.
Yes, kag specifically no, ano yung ingan naton nga topic subong aga.
This morning,
Yes.
we have a very interesting topic,
Ooh.
no? It's about UTI. So ano ning UTI kapag laom ninyo?
Urinary tract infection. No?
Lain man na iya ang umibig tapos iniwan kapag laom
Lain na
ninyo.
guro. May ginapabati-batian ka guro. Pero
So lain man na siya yung
Lain,
topic.
lain,
So today
lain.
is about urinary tract infection.
Yes.
All right.
tract infection.
So any thoughts about UTI kapag laom ninyo?
As we've been discussed a while ago na sa backstage ng urinary tract infection is all about infection sa agihan sang ihi. No?
Oh.
Amo na nakasimple. But we will going to dig deeper karon pag discuss naton upod sa aton nga speaker.
All right. So I know nga damo gid ang makarelate sa ni kay
Yes.
this is a very common nga topiko no or topic sa aton nga mga tumalanaw. But ano gid bala ang mga basics sini or ang details pagid sini kay familiar na ta sang UTI pero bilang takabati nga may UTI si amo ni si amo to. No, but the details of this kag kun ano ang pwede mangin mahimo naton later on, no?
Yes.
Kaupod sa aton speaker kapag laom ninyo later.
Later ba?
All right. So sa pagbalik namon mga kapaglaom ato na mangin kaupod ang aton invited speaker sini nga aga. The Voice of Health will be right back.
For your healthy meal options, visit us at Nutribites Cafeteria, located at the West Wing ground floor of Adventist Medical Center, Bacolod. Available for delivery via Food Panda. You may also visit us at Fruits and Bites, located at the ground floor of the new Simplicio Palanca Medical Arts Building of Adventist Medical Center, Bacolod.
We are happy to bring you our BAMSI Happy Card, Hospital Affiliation Privilege Incentive Program for our loyal patients. Discounted hospital services for our card holders, plus the additional perks of discount privileges up to 30% with our partnered companies. For more information, please contact us at 034-488-7777, local 335. Cell phone number 0921-299-2122. You may email us at marketing@adventisthealth-bcd.com. For healthcare needs such as executive checkup and annual physical exam, visit us at Adventist Medical Center, Bacolod, Xavier Ramos Avenue, Tacoling, Bacolod City. Call us at telephone number 488-7777 or email us at info@adventisthealth-bcd.com. or DM us at our official Facebook page at Adventist Medical Center, Bacolod.
And we're back mga kapaglaom. So, diri lang ta sa Hope Channel Bacolod sa The Voice of Health. So, siningation, gina-introduce na ako ang aton nga speaker. Siya ay doctor and also a family medicine second year resident. Graduated in LaSalle, no? Sa College of Medicine from Bacolod City, no other than Dr. Ruth Esther Velas. Hello, Doc.
Hello, Doc. Happy morning.
Happy
Welcome to the Voice of Health. And it's nice kapag laon ninyo, no, kay si Doc naghatagid sa iyation to share, no, about naman niya sa topiko sa buong aga. And na hatag ta na kaina ang kung ano nga topic, no, ang aton nga pag-istoryahan subong, no, UTI, Doc, no. Urinary tract infection. Ayan. So, Doc, before we start sa imong lecture, we're giving you the time to say greetings probably sa imong mga kilala or family.
Good morning, everyone. I would like to greet my fellow residents in the Department of Family and Community Medicine, also the Health and Lifestyle Institute, Dr. Vici Fernan, our chairman of our department, Dr. Sanson, and our training officer, Dr. Perenio. Most of all, I would like to greet my family, my husband, and my child. Hello.
Ayan. So, salamat gid, Doc, no, sa pagliwat sa pagbaton sang amon nga invitasyon dire. And again, mga kapaglaom, we are inviting you to share this episode, no? Yes. Kapaglaom ninyo bago si Doc magasugod kay parang mas madamo pagid ang mabless ang sining topic this morning.
Yes, no other further ado, no? We can start now, Doc, if you are ready.
Okay.
You can start your
Yes,
presentation.
interested na kita mamati tanan.
Yes.
Okay. So, good morning, everyone. Today, we will be talking about urinary tract infection, or what we commonly know as UTI. So, what is UTI? This is an infection in any part of your urinary system, which includes your kidneys, ang aton bato. This filters the blood to produce urine, or ang aton nga ihi. Your ureters, the tubes that carry urine from the kidneys to your bladder. Your bladder, what we usually call our barukan, this stores our urine. And your urethra, the tube that carries urine from the bladder to the outside. Amuni ang ginagwaan sang aton ihi. So UTI is a common and painful illness, but thankfully this is responsive and can be easily treated with your antibiotics. So when you say urinary tract infection, this includes a variety of clinical entities. It may include cystitis, infection that involves your barukan or your urinary bladder. If it reaches your kidneys, then your UTI will be called pyelonephritis, and some may have asymptomatic bacteriuria, where there are abnormal findings in your urine of someone who does not have symptoms. So, who are more commonly affected by UTI? Sino ang kalabanan nagka-UTI? So, except among infants and our elderly lolos and lolas, UTI occurs more commonly in females than in males. So, during the neonatal period, this is our babies who are younger than 1 month old, the incidence of UTI is more common in males. This is because congenital urinary tract anomalies are more common in baby boys than in baby girls. While among 50-year-old and above, the rate of UTI is as high among men as among women. So, patas na siya mag-edad na ang mga lalaki. This is because obstruction from prostatic hypertrophy becomes more common in men during this age. So, ang posibleng kabangdanan or factors that increase the risk of contracting UTI are as follows. So, among young healthy women, the risk increases among those who have frequent sexual intercourse and those with a new sexual partner. This is because bacteria can enter the bladder after sexual intercourse. Another risk is recent use of diaphragm with spermicide. Isa ni siya kaklase sang sexual contraceptive device, as certain spermicides may alter or change our normal vaginal flora. Also, those who have a history of UTI in the previous 12 months and a maternal history of UTI. Kay may iban nga babae, may genes na mas susceptible sila makolonize sang certain bacteria sa ila kinatawo. So, diabetes is also a risk factor due to impaired immune response, and incontinence, presence of residual urine in the bladder, or any condition that allows stasis of urine can increase your risk of UTI. In postmenopausal women naman, sa may mga edad na mga females naton, factors that can increase the risk of UTI may be a history of UTI prior to menopause, cystoceles. This is when the muscles and surrounding tissues around your bladder and vaginal wall become weak, so resulting in a prolapse. Also, urinary incontinence and residual urine, or anything that may inhibit your urine from passing through and resulting in urine stasis. So this can increase your risk of UTI. In men, as they age, the risk of UTI increases due to urinary obstruction. As I previously mentioned, mas gaedad ang aton ng mga males, the risk increases kay common sa ila nagadako ang prostate. And lastly, the lack of circumcision. This may also be a risk factor, as bacteria may gather in the glands and prepuce, which may travel in the urinary tract of our uncircumcised men. So, ang higko gatipon sa sulod sang panit, kag pwede magsaka sa ilang urinary tract. So, how does UTI happen? Okay, so as you can see, this is our urinary tract and can be viewed as one continuous unit. So, ga-connect na siya, where our urine travels, extending from the urethra to the kidneys. So, most UTIs happen when the bacteria starts by infecting the urethra kung diin na gagwa ang aton ihi. So, muna siya sa dalom. Since amo ini ang exposed outside, then eventually going up to the bladder, up to the ureters, and may eventually lead up to the kidney. But the presence of bacteria into the bladder does not necessarily lead to sustained and symptomatic infection. So it does not necessarily mean na kung may bacteria na kita dira, magka-UTI na kita insigida or posible magdiretso na agad-agad sa kidneys. It depends on our body, on the kind of bacteria and other factors, whether we will actually have UTI or not. So, for example, after sexual intercourse, bacteria may enter our urinary bladder, but urinating after intercourse and together with our body's immune response if bakod lang man ang aton immune system against these bacteria, this may eliminate these organisms. So UTI does not happen right away. But if there are abnormalities in our urinary tract, or there is an object such as a catheter or a urinary stone, it may provide a place for the bacteria to stay, increasing our risk for infection. So when we are suspecting UTI, we classify it depending on the different clinical syndromes. So this is because we manage each kind of UTI differently. So may lain-lain kita klase na UTI and lainay man ang pagbulong naton sina. Depending on the kind of UTI, the medications, the length of antibiotic use, and even the laboratory tests, it may differ on the kind of UTI. So let us start with asymptomatic bacteriuria. When we say asymptomatic, this means without any symptoms. So the patient does not feel anything. That is related to UTI, but bacteria in urine has been identified in the laboratory result incidentally during screening, and that urine specimens that have been collected properly has not been contaminated. So in women without symptoms, makahambal kita may bacteriuria if may 2 urine culture results na more than or equal to 100,000 colony-forming units. So, makita taninay sa laboratory results. In men without symptoms, pwede isa lang yak resulta basta wala contamination ang pagkolekta. And if hindi available ang urine culture, 2 samples of midstream clean catch urine samples ang urinalysis. This should have pyuria or may WBC of more than 10 or more than 2 microorganisms. So the question now is, if you have asymptomatic bacteriuria, do we need to treat it? So based on the recommendations of our Philippine clinical guidelines, if you are a healthy adult, routine screening and treatment is not needed. Likewise, it is also not recommended among the following. So, ang may mga diabetes, ang mga elderly patients naton, those with catheters, solid organ transplant patients, people with HIV, spinal cord injury patients, or patients with urologic abnormality. So, take note, this is asymptomatic bacteriuria. But this is a case-to-case basis depending sa examination sang inyong nga doktor. So, who will need to be tested? And even though they are asymptomatic, maski wala mga sintomas, and if there are findings in their urine, who needs to be treated? So, these are the people who will undergo genitourinary manipulation or instrumentation. So, ang mga tao na olaperahan sa ila genitourinary system. Also, all pregnant women with asymptomatic bacteriuria should be treated as well. This is to prevent bacteremia and sepsis. So, na-prevent ta ang paglaptas ng infection sa dugo sa mga pregnant women naton. So, asymptomatic bacteriuria in pregnancy should be treated with antibiotics to reduce the risk of bladder and kidney infection, as this may result in low birth weight neonates and preterm infants. So the risk of acquiring bacteriuria increased with the duration of pregnancy. So ang highest na time is between the 9th and 17th week of pregnancy. That's around 2 to 4 months. So the optimal time to screen our pregnant mommies is at 16th week of pregnancy. Hindi basta-basta magka-UTI sa gabusong. So, if we are diagnosed with asymptomatic bacteriuria, antibiotics should be initiated upon diagnosis. So, we need to consult with our doctors, as not all kinds of antibiotics are given to our pregnant women. And these are the few selected ones that are safe. So, after completing 1 week of treatment, follow-up urine culture should be done. So, treating our pregnant mommies is important, as pwede ini magresulta sa komplikasyon if pabayaan lang. So, pwede ini magsaka sa aton barukan, kag kidney, kag mag-cause cystitis or pyelonephritis. Kag ang infection sa lawas, pwede mag-cause low birth weight sa aton nga babies and mag-cause preterm delivery. So another kind of UTI is acute uncomplicated cystitis. When bacteria from the urethra ascends to the urinary bladder and causes an infection. So this is suspected in premenopausal, non-pregnant women. So ang acute uncomplicated ni siya. Who presents with acute onset of painful urination, sakit mangihi, urinary frequency, so amo ni siya ang ginatawag nga busisaw, urinary urgency, and blood in our urine. So dapat wala ini signs of vaginal discharges. So urinalysis is not necessary to confirm the diagnosis of acute uncomplicated cystitis in women presenting with one or more of the above symptoms of UTI in the absence of vaginal discharge and complicating conditions. So if may vaginal discharges, like daw ka cheese-like or thick yellowish or greenish na discharge upon examination, we need further examination and tests. So this may be needed kay base hindi na UTI, base STD na siya. So the most cost-effective approach in acute uncomplicated cystitis is empiric antibiotic treatment. So bulngon tana dayon based sa pinaka-common cause of bacteria nga ga-cause ng UTI. So question, paano ya ang mga elderly lolos and lolas as long as healthy and wala man sila mga complications, ang pagbulong sa ila the same man sa aton nga young and healthy population. So what about naman our pregnant mommies who have acute uncomplicated cystitis? So among pregnant women who have cystitis, this should be treated right away with antibiotics to prevent infection of the kidney. So if you feel that you have UTI-related symptoms, go see your doctor because need gini siya i-treat if gabusong ikaw. So after treatment of the pregnant women with cystitis, follow-up should be done with your doctor as confirmatory tests should be done to check if the bacteria has been eradicated. So what would happen if you feel that your symptoms have worsened or you feel that there has been no improvement even after you have completed your medications? So follow-up should be done with your doctor so that a urine culture test can be done and the antibiotics changed empirically. So meaning it is based on the most common cause of bacteria that may be causing your UTI while waiting for your lab results. So pag wala ka na ayo, despite na tapos mo na imubulong, without fail, kag insyakto man ang imo pag-inom, you will be managed as complicated UTI already. So, lain naman niya ang pagbulong or kalawigon sang bulong na ihatag sa imo if complicated na ang imo UTI. So, another kind of UTI is acute uncomplicated pyelonephritis. This is when the bacteria ascends up to the kidneys and cause an infection. So, if kidney na, pyelonephritis. If ang imo nga barokan or urinary bladder, cystitis. Okay? So, if uncomplicated, this is suspected in healthy women who have no other diseases in the urinary tract that may cause obstruction or abnormalities in function who present with the following symptoms. So, kalabanan, nagahilanat, maghambal kita fever, ang temperature is 38 degrees Celsius and above. And those nga ga-chills, gapalanugnawan, gakurog, also those with flank pain, sakit dampi sa may balikawang, or ang lower back naton. So, mag-examine ang doktor, magpisga sa imo likod, may costovertebral angle tenderness nga ginatawag. Sakit kung pisgaon, dira na area. And also those with nausea and vomiting, ang gasululuka, with or without symptoms of lower UTI. So, maski wala kita ginabusisaw or maski wala kita sintomas nga sakit mangihi, pero may mga amutani nga sintomas ang lista ko. pwede kita mag-suspect of acute uncomplicated pyelonephritis. So, sa kidney na ni siya ang aton nga infection. So, laboratory findings include pyuria. So, ang may na sa ihi, more than 5 or more WBC per HPF of centrifuged urine on urinalysis, and bacteriuria with counts of 10,000 or more CFU per milliliter on urine culture. So, it is important to go see your doctor as certain laboratory tests need to be taken, such as urine culture and gram staining, to check what kind of bacteria need to be treated. Dira kami mabase sang antibiotic nga ihatag sa aton nga mga patients nga may acute uncomplicated pyelonephritis. So, do ka busy table, but this is a table showing the different antibiotics that may be used when treating cystitis and pyelonephritis. Do kadamo gid no. So, as you can see, kadamo classes ang antibiotics. There are a lot of medications that can be given and may differ in frequency and duration. Some medications are given for 1 dose only, while some are given for 3 days, and others for 7 to 14 days, which is why it is important to have yourself checked by your doctor. So, I have encountered several patients self-medicating with amoxicillin bought at the Changi or given by friends. So, please take note kung himutaran mo da ang laba-laba nga lista, amoxicillin is not at all in the list given for UTI. So, if you look closely, wala gid siya sa lista ta. So, please let us stop self-medicating with antibiotics as it may cause resistance in your body. So, who needs radiologic imaging? If you have pyelonephritis, do you need to undergo radiologic imaging such as ultrasound or CT scan right away? So, the answer is no. It is not routinely recommended for everyone, but if you continue to have fever for even after 72 hours or 3 days of antibiotic use, then we may need to rule out nephrolithiasis, so mga bato sa kidney, urinary tract obstruction, mga abscesses, or other complications of pyelonephritis. So, ginausar ini para mangita other causes nga wala ikaw gaayo. So, if we see any abnormality in your ultrasound or CT scan results, then you may need to be seen or referred to a specialist of the urinary tract or kidneys. So, these are your urologists or your nephrologists. So, during your course of your treatment, your doctor might ask you to follow up so we can check if you are responding to your medications. So, the next question is, what laboratory tests do you need to comply with or follow up for checkup? So, if after 72 hours or 3 days na you are not improving, then you need to go back to your doctor to have your urine checked again. But if you are responding to your antibiotics, then most probably your doctor will not ask for a repeat laboratory test. So, now what will happen if you have already finished treatment but your symptoms come back? Then you will need to follow up also. So, this is an indication for additional workup to rule out other causes. So, basi may iban nga cause such as your nephrolithiasis or bato sa kidney, your urinary tract obstruction, renal or perinephric abscesses, or other complications ng pyelonephritis. So, antibiotic treatment will then take longer than the usual treatment. So, who needs to be admitted? This is an important question, as this will tell you who will really need to see the doctor or proceed to the emergency room and be admitted. What do we need to watch out for? So, the inability to maintain oral hydration or take medications. Those patients who keep on vomiting, suka lang na suka. So, aside from they cannot take their oral medicines, they are at risk for dehydration as well. Next is concern about compliance. So, Those concerned about compliance in taking their medicines, like children or those elderly who might not take or swallow or complete their medication. So kung though hindi nila pag-imnon, kag hindi sila maayo, then most probably basi ipaagi na lang sa ugat ang bulong. Presence of complicating conditions such as diabetes, those with catheters, those na may mga tumors, enlarged prostate, kidney or bladder stones, may mga CKD, chronic kidney disease, aton nga immunocompromised patients, and other diseases that may obstruct the urine or change its course may warrant admission, as these patients are at risk na mag-progress or maglala ang infection. And if your infection is debilitating, causing very high fever, severe pain, and signs of sepsis, meaning your infection is already causing a life-threatening condition caused by your body's response to an infection, damaging its own tissues. So if the patient is experiencing more than 2 of these, ginahapo, increased rate of breathing, mga more than 22 breaths per minute, then altered na iya mental status, kaluya na gid, nakabudlay na pukawon, gatulog na lang, kag hindi nagabangon, ang BP naganubo, kaga less than 100 nang iyang systolic blood pressure, kinahanglan tanin sila dalon sa ospital para ma-admit. So let us proceed to the complicated kind of UTI. Sila ni ang may extra consideration when it comes to laboratory tests and medications because these patients have a higher risk na maglala ang infection. Hindi basta-basta gaayo, gabalik-balik ang UTI, or pwede hindi mag-respond insikita sa antibiotics that are given and therefore need to be monitored. So how do we know your UTI is complicated? So when you have the usual symptoms of UTI, fever and chills, busisaw, sakit mangihi, may dugo ang ihi, sakit ang puson, or may lower back pain, plus significant bacteriuria in your urine, plus the following conditions, amuning din lista ko. So, example, those with urinary catheters, or may mga incomplete emptying of bladder, neurogenic bladder, cystocele, obstructive uropathy, may mga bato, may mga tumors, ang may mga CKD, may mga diabetes, and those nga may mga immunocompromised patients naton, and also UTI in males except in young males presenting exclusively with lower UTI symptoms. So when you have the usual, so in summary, your UTI is considered complicated if you have functional or anatomical abnormalities in your urinary tract or kidneys, have presence of an underlying disease that interferes with your immune system, or any condition that increases the risk of acquiring infection and treatment failure. So if you have these conditions that make UTI complicated and you suspect you have symptoms relating to UTI, please go see your doctor because there are certain tests that need to be done before starting your medications. So the laboratory tests needed before initiating treatment are your urine gram stain, culture, and sensitivity testing, since complicated UTI may have a risk of persistent, recurrent, so pabalik-balik, or treatment failure. These tests show what kind of bacteria that is causing your infection and what kind of antibiotic will work best for you. So if your doctor suspects that there are abnormalities in your urinary tract, for example, may mga renal stones or enlarged prostate or abscesses, we may request additional tests like CT scan or your KUB ultrasound to check your urinary tract. So, when is catheter-associated UTI suspected? So, amuning may mga UTI nga may mga catheter. These are suspected in patients who have indwelling urethral or suprapubic catheter, or those undergoing intermittent catheterization, or those with a history that has been removed within the past 48 hours who present with fever with no other focus or any other symptoms of UTI. So, fever lang. So, the urine culture have at least 10 to the third power colony-forming units of at least one bacterial species that are present in a single catheter urine specimen or in a midstream voided urine specimen. So, amuning makita ta sa aton laboratory results. UTI in men is also considered a complicated case. So, this is more common in older men as they age. The risk of UTI increases due to urinary obstruction from prostatic hypertrophy. As a result, this population have a higher risk of catheterization as well. So, kay obstructed, so mas prone pagid sila nga makatheter. In younger men, infection of the urinary tract may be a result of anal sex. Those who are not circumcised, as bacteria may gather in the glands and prepuce, which may travel into the urinary tract of our uncircumcised men. And those who have sexual partners colonized with uropathogens, meaning may bacterial growth and proliferation. So, in men, mas nubo ang need na bacteria sa urine culture to diagnose urinary tract infection. Unlike in women, that needs only 100,000 CFU per ml. In men, only 1,000 lang is needed to diagnose UTI. So, once a doctor diagnosed you with UTI, ginatreat ni sila with a 7-day antibiotic therapy. Mas jutay ang choices naton sa men compared to sa laba-laba itong lista kagina for the women. So, make sure to have yourself checked by your doctor para ma-prescribean kita sang insakto na bulong. However, more extensive courses may be required. For example, men with associated UTI and prostatitis. So, among young men with acute cystitis, nga ga-respond ba niya sa aton antibiotics given for 7 days, then most probably, hindi na kita mag-additional workup. But if magsigi ang UTI or if maglabot sa kidney, which is your pyelonephritis, or if sige gid siya balik-balik ang UTI, then urologic evaluation should be performed. So, among those with complicated UTI, who will need to be admitted? Tanan ba na complicated UTI, gina-admit na ni siya? So, those who will be advised admissions are the ones who have marked disability, severe pain, and those who are septic. So, disoriented, luya-luya na, and hindi na mayo kabangon, ginahapo, or ganubo na ang BP. So, those patients in whom there is uncertainty in diagnosis, so need ni siya further workup. And also patients in whom there is concern about adherence to treatment, and ang mga gasigi suka na hindi kainom bulong, better to have the medicines given through IV, ipaagi na lang gid sa ugat. So, patients with mild to moderate illness, so, amo ning kagina ang hindi siya kinahanglan aladmiton, and who do not fall under the above categories, this may be treated on outpatient basis. So, pwede ni sila papulion kag tagaan oral antibiotics, provided dapat ma-monitor gid sa balay kung mag-develop sang mga sintomas na kinahanglan aladmiton, then mabalik gid dapat sa hospital. So, now that we have discussed the different kinds of UTI, what to watch out for, who needs to be admitted, and those who can be treated as outpatient, what can we, the general public, do to prevent UTI? Paano tani siya malikawan para mag-lessen ang risgo maka-UTI? So, since risk factor ang sexual intercourse at it may introduce bacteria to your urinary tract, it is recommended to urinate after sexual activity. And then, we should stay well hydrated. So, remember, the recommended healthy amount is at least 8 glasses per day. So, that's approximately 2 liters per day. So, staying well hydrated helps dilute your urine and ensures that you urinate more frequently. So, ma-wash out ni siya and ma-dilute, allowing the bacteria to be flushed out from the urinary tract before an infection can even begin. So, another is to take showers instead of hot tub baths. I know it's not relatable in our setting because tabo and balde is real. But the reason for this is staying for a period of time in a bathtub may cause the soap to irritate your urinary tract, and a hot and moist environment is a good place for bacteria to grow. So another is to minimize douching, sprays, or powders in the genital area. Also, to avoid diaphragm contraceptives with spermicides. So these may alter the natural bacteria in the women's private parts and increase the risk of infection. And lastly, for women, let us practice wiping our genitals and anal area from front to back. So, halin sa front, pakato sa buli. So as to minimize transferring bacteria from the rectum to the urinary tract. So now, what about those women? Okay. What about those women who really have recurrent UTI? Pabalik-balik ang UTI within the year. Yes, it is actually common. So what can we do about it? So as we have discussed, we can check base ang mode of birth control like vaginal douche or diaphragm have spermicides that can alter the vaginal normal bacteria. So if they do use this, we can change it. There are also over-the-counter products such as cranberry juice or tablets to help reduce recurrent UTI. But studies have shown no benefit with cranberry, and those studies showing that cranberry and D-mannose reduce the risk of recurrent bladder infections are not convincing. So, hindi pa ni siya proven. May ongoing studies pa kita diri. Next is hydrate. Drink the right amount of water every day. So not only will it lessen your risk of recurrent UTI, it has a lot of health benefits too. So as previously discussed, urinating after intercourse, and for postmenopausal women who develop recurrent bladder infections may benefit from using vaginal estrogen. So this may be available in a flexible ring worn in the vagina, or a small vaginal insert, or a cream. So you may want to visit your gynecologist and discuss these options. And lastly, if all these measures have been done but still recurrent gidyagapon ang UTI and causing you discomfort, then we can use preventive antibiotics. So this is our last resort since hindi man kita gusto magka-antibiotic resistance. So you have the options to use continuous antibiotics, low-dose antibiotic once a day or 3 times per week, antibiotics following intercourse, or self-treatment. So at the first sign of a bladder infection may be recommended in some situations. So, before starting this regimen, it is important you have had urine testing at least once in the past to confirm kung UTI gid man to ang imong sintomas. So, antibiotic use need to be discussed and prescribed by your doctor as long as it is indicated. Hindi kita magmato-mato lang because irresponsible use of antibiotics may result in resistance and unneeded side effects. So lastly, what about those with catheters? Since they are already at increased risk for developing UTI, what can we do to lessen the risk? So use of indwelling catheters only when necessary. So kung kinanglanon lang gid. Use aseptic technique including appropriate hand hygiene and sterile gloves. May technique ni siya nga pagpasulod sang catheter to lessen contamination of bacteria. So that is why trained health personnel should be the one to insert Foley catheters. Properly secure catheters after insertion to prevent movement and urethral traction. So make sure ta hindi siya dali ma-dislodge or mabutungan. And also, maintain a closed, sterile drainage system para hindi makontaminate. And Maintain good hygiene at the catheter urethral interface. So don't forget to clean the private part of our patient with catheters. Maintain unobstructed flow. Make sure wala gabara ang ihi. Check the bag and the tubings regularly if inchakto ang flow sa urine. And also remove catheters when no longer needed as per advice by your doctors. And do not change indwelling catheters or drainage bags at fixed intervals. So, that is all for today's discussion on urinary tract infection. I hope may nalearn man kamo. To summarize it, there are different kinds of UTIs depending on the part of the urinary tract that is affected. So please make sure to visit your doctor if you develop symptoms of UTI, as the antibiotics that will be given will depend on what kind of UTI you have. If complicated ang UTI, then the treatment may be higher in dosage or longer in duration. If gabusong, hindi gid pagpabayaan ang UTI. Magkadto man kita sa aton nga mga doktor kay may mga komplikasyon ini kay baby. And let us not forget also ang mga balantayan nato na patients that will need to be brought to the hospital right away. And lastly, I hope we can practice the preventive measures, especially the women, because we are more at risk of developing UTI. So thank you for your time, and thank you Hope Channel for this opportunity to share helpful information in our community. So may God bless us all. Thank you again.
And thank you very much, Doc, for that very informative lecture for our viewers today. Kapag laom ninyo, kanami gid sang topic ni Doc no kay ang simple ko nga mga ideas about UTI mas nag-deeper pagid ang akon nga naintindihan about UTI. Hindi gali basta-basta ang UTI. No?
Yes, hindi gali basta-basta. And also Lord, I also thank you Doctor kay na-refresh ang akon nga idea about UTI, and also no damo pagid ko na learn sa ani nga topic. So, gina-invite ko gali ang mga viewers sa aton nga Facebook page and also sa aton nga live no nga you can comment your suggestion and also your questions sa aton nga comment section, and also you can text or you can call if you have time sa aton nga hotline number liwaton ko naka-flash sa screen 0921-299-2122 liwaton ko 0921-299-2122.
Alright, so pero bago naton pagkasabton ang mga pamangkot nga iga-send nila sa aton nga mga pages kapag laom ninyo no. Maghahatag kita anay sang short break.
Yes.
Para nga pagbalik naton nakasend naman ang aton nga mga viewers ang ilang nga mga clarifications or questions regarding the topic today. So the Voice of Health will be right back.
The people in this world need to know that the signs of the times are fulfilling. Please join with me to take this missionary book of the year designated for the year 2022, the final hope to every household. This is to help inform people around the world about the three angels' messages with a loud voice. People are suffering and challenged tremendously during this worldwide pandemic. Some people lost their loved ones. Some were challenged emotionally and financially. But despite all of these challenges, we proclaim that there is hope, and we have no time to lose. The world needs to know hope in Jesus. Therefore, Ellen White says, it is a privilege of every Christian not to look for, but to hasten the coming of our Lord Jesus Christ. Family and friends, let us work together as we share this booklet like never before, so that people who will receive it will also be prepared and we get ready for the soon coming of Jesus. Maranatha.
We are happy to bring you our Bouncy Happy Card, Hospital Affiliation Privilege Incentive Program for loyal patients. Discounted hospital services for card holders, plus the additional perks of discount privileges up to 30% with our partnered companies. For more information, please contact us at 034 488-7777, local 335. Cell phone number 0921-299-2122. You may email us at marketing@adventisthealth-bcd.com. For healthcare needs such as executive checkup and annual physical exam, visit us at Adventist Medical Center, Bacolod, Xavier Ramos Avenue, Tacoling, Bacolod City. Call us at telephone number 488-7777 or email us at info@adventisthealth-bcd.com or DM us at our official Facebook page at Adventist Medical Center, Bacolod.
For your healthy meal options, visit us at Nutribites Cafeteria, located at the West Wing ground floor of Adventist Medical Center, Bacolod. Available for delivery via Food Panda. You may also visit us at Fruits and Bites, located at the ground floor of the new Simplicio Palanca Medical Arts Building of Adventist Medical Center, Bacolod.
Welcome again sa aton nga The Voice of Health. And ginagikilay namo na aton nga 10 viewers sa aton nga Hope Channel Bacolod. Especially kay Rayadon Homolito kag si Emerald Sanchez. Happy viewing sa inyo tanan. Dara sa aton nga Hope Channel Bacolod live page.
Alright, and we also want to greet ang aton nga mga kaupo dira liwat sa Adventist Medical Center Bacolod, sakay kapaglaom Luz Casas sa
Yes.
HLI, Health and Lifestyle Institute Department. Thank you for the full support of this program.
Yes.
Alright, so kapaglaom ninyo, ari na kita subong sa question and answer portion, nag-check ako kapaglaom ninyo sa Adventist Medical Center nga Bacolod nga page. Wala asang question ang siningon kapaglaom ninyo. Naintindihan gid nila. Well presented ang topic ni Doc.
Yes.
So, pero I know sa imo guro kapaglaom ninyo may ara dira mga pamangkot.
Actually, pamangkot na personal question lang na siya. Actually, search ko sa Google. Pero but it's a simple man lang siya, Doc. Ay related man sa imo ginhambal kagina. So first question, I guess can UTI go away on its own? Okay, may iban bing mga mayara ko akon nga parents, akon nga mother ko, mayara nagka-UTI siya and lately lang naman nabalaan. Kag pagka nabalaan namon, nadula nang iya So can UTI go away on its own?
So, as previously discussed, to kagina na hambal ko na sometimes if may bacteria and may infection, it does not necessarily mean na magka-UTI kita or magka-cystitis kita right away or pyelonephritis right away. It also depends on our immune system and the environment of our urinary tract if ma-develop gid siya sang full-blown nga infection. So, may man defense mechanism sang aton body. Galing amulan na, sometimes hindi ta mapaktan. May iban gid ya nga ga-progress and may iban nga wala man. So, kalabanan ni ang may mga risk factors to kagina nga gin-discuss ko. So, if healthy ka man lang and wala man complicating factors, then sometimes maka-fight man ang aton body. Pero, if amo na nga may symptoms ka, then wala gid siya nadula, sige gid siya persist, kag wala siya nga go away, then best na ipa-check up ta na lang kay base mag-progress.
Yes. A follow-up question, Doc, ha? Is it kung nadula siya, then nagpa-check up, is it okay?
Okay, it depends man sa findings kag sa examination. So, kung sa aton nga physical exam, kag sa aton nga laboratory tests, kung may infection pa or wala naman infection, then it depends kung need pa i-treat or not.
Yes, thank you, Doc. Basta yung paglaom, Marvin.
Yes, thank you very much, Doc.
Thank you for the
May ara na kita question kapag laom ninyo, from number nga 2611 ang iyang ending. Doc, ang iya pamangkot, Doc. What are the drinks nga if you have UTI, what are the drinks nga pwede mo gamiton aside of course sa kainag istorya kami ni Doc is during the break nga ang buko ya pwede get buko juice. No, but on top sang buko juice, Doc, ano pagit ang pwede nga mga drinks kag hindi pwede if you have UTI?
Okay. So if you have the symptoms and you are being treated, maka-help man ang mga other juices na can keep you hydrated kag maka-diuresis sa imo. So okay to siya ang buko juice. May iban nga pwede man ka-take sang cranberry juice amo tong sa studies nga prevent ya ang mga bacteria mag-stick sa lining sang imo urinary bladder, but wala pa sang studies gid bala nga maka-prove. Pero if you're being treated naman, then pwede ka man ka-take as adjunct na lang to help man kag hydrate mo man ang imo self. So other drinks naman na try to avoid if may UTI, does not necessarily mean sila ni ang mga drinks nga gakos ang UTI, but this can aggravate or mag-worsen sang imo mga symptoms. So soft drinks, mga carbonated drinks, coffee, kay pwede ni sila mag-irritate sang imo nga urinary bladder. So kung nabusisaw ka na nga daan or sakit mangihi, pwede ni siya mag-irritate kang mag-worsen sang imo mga symptoms. Oo.
Ayan, so very clear mga kapaglaom nung ang mga drinks like soft drinks, no, which is most of us Filipinos are fond of, no, mga kapaglaom ninyo. So if you have UTI gali, let's avoid such kind of drinks, Doc, no, kay makabulig pagid siya irritate. And syempre, aside nga hindi na siya healthy kapag laom ninyo ang soft drink, siguro it's better to stick to the most effective gid nga drink, which is water, no, water gid para nga hindi na maglala pagid kay as Doc mentioned kaina during her lecture nga ang UTI gali kapag laom ninyo, pwede siya magsaka pagid into complicated nga UTI. So I mean we are familiar of UTI, but kung maglala pagid siya gali, dako man ang iyang health impact no sa aton.
Yes, kag may patient kami, no, relate ko lang sa patient na. May patient din kami na UTI lang siya, then after that ginpabayaan niya lang, nauwi siya sang renal failure. And then after that nag-sepsis kay naglala pagid kay without treating that kind of simple, no, UTI can leads to more complicated.
Yes, simple condition. Pero pwede siya maglala.
Yes,
no? Ayan.
But anyway, may ako di question actually kapag laom Marvin, related sa COVID. Actually, sa related COVID kay damo na subong cases ng COVID na naman, no?
Yes,
so that's why we are wearing mask. But here, question dere, can a COVID affect urinary tract or it can cause urinary UTI if you have any
so far sa aton nga mga staff nga ginamonitor ta, wala pa man sang may naga-complain or any finding nga related gid sila. Pero pwede mag-coexist magdungan. So pwede nga at the same time while na COVID ka, pwede nga nagka-UTI ka man. So aside sina nga gamasakit ka, nag-down pagid ang imo nga immune system, kag nag-lessen ang imo nga defense to eliminate those bacteria. So pwede man nga nag-UTI kaya together with your COVID, but not necessarily nga ang COVID ang nag-cause ng imo nga UTI. Kay ting common cause ta sang UTI is ang aton nga E. coli nga bacteria mo. So amo na siya yung common cause. So pwede na kung nag-down imo nga immune system, pwede nga na nabudlayan ang body mo, i-eliminate ni ang mga bacteria kag mag-cause sa imo sang infection.
So bagay na kung may COVID ka, maluya yung immune system, then more infection ang receive sa mga
lawas. So daw grabe na gid nga experience kapag laom ninyo nang nagka-COVID ka na, gina-UTI ka pagid. So grabe na gid na. So
it's possible.
And but it's possible. Yes, that's true. It's possible. And also, may take away ko lang niya kapag laom ninyo kaina sa lecture ni Doc, no, nga nakita ko Doc kami personally sang gagmay kami kag sa amon man nga mga sa kay nanay sa mga utod ko nga may mga bata, they are fond of putting powder after paligo lang sang baby. So kaina mga kapaglaom nga hindi gali siya gina-advise, no, because it can cause irritation.
Yes, irritation and changes sa normal nga flora sang aton nga vaginal kag urethral nga wall.
Ayan, so sa mga aton kapag laom dira nga mga nanay no nga naga-practice sini. So at least straight from Dr. Velis nga it's not advisable because of its effect nga pwede gidya maka-irritate ang genital part sang baby. And another one kapag laom ninyo, gin-mention kay ina ni Doc nga ang kaimportante man sang circumcision kay it can also cause UTI no kay pwede dira magstay ang bacteria. So so there's a reason, health reason gali behind sang circumcision kapag laom ninyo no kay it's not just the covenant ginhimo sang Ginoo no nga kay Abraham and his seed nga magpa-circumcise no as a covenant, but there's a health reason behind that no nga amo na. So for those no base sa mga kapaglaom ta nga ga-contemplate nga ipa-circumcise yung inyong mga bata no we are open no sa Adventist Medical Center Bacolod. And actually, you can just dial 488-4 masigway ko lang kapag laom ninyo, no? Nga, we offer circumcision dire sa Adventist Medical Center Bacolod. And I know man now the reason why kay sang una bidok nga kinahanglan gid magpa-circumcise no sa mga nagalantaw subong. So at least now it's very clear nga there's health reason behind circumcision.
Yes, thank you very much. Na maybe this is the last question that I will ask Doctor. Doc, what are the simple ways to prevent UTI? Simple ways kay ano lang sa mga viewers lang natin nga layo ang mga layo ang mga balay nila sa hospital, hindi sila makaka-check up. So what are the simple ways to prevent UTI and how to treat UTI at home? O mayroon ba mga UTI test mayroon na sa buong UTI test or sa balay that we can test if may UTI ka or something.
Pwede siguro siguro Doc, Doc Band-Aid solution while we are not yet in the hospital for treatment or consultation abi sa doktor. No Doc Band-Aid treatment bisa mga nabukid yang part mga utod na tunyara sa rural areas.
So as previously discussed to ang ways to prevent UTI, so amo to siya stay well hydrated kay as long as well hydrated kita, ang water it will flush out the bacteria and then it will also dilute your urine. Also amo to ang aton nga mga little girls and also the women kung sino pang hindi kabalo mag-wipe ta from front to back kay para ang higko sa buli hindi siya magkadto sa aton nga alagyan sang aton nga ihi. Also amo to urinating after sexual intercourse. And also ang mga kinds of tawag ang aton nga kinds of contraceptives. So avoid kita anything nga mag-manipulate da or alter kay basi mag-cause man sang UTI. So kung ara kita sa balay actually mag-diagnose kita sang atong ginlista ko to kaginang acute complicated cystitis. Clinical naman lang mag-diagnose. So, hindi man siya necessarily nga may test gid. So, as long as together ning mga sintomas ta nabusisaw, na sakit ang balikawang, sakit ang puson, may dugo ang ihi, sakit ang ginagwaan ka ihi. So, hindi na siya need nga i-test gid for UTI. Obvious na gid na siya nga symptoms na siya sang UTI. So, as I have previously explained na kung healthy yung individual man kita, sometimes kaya man ni siya sang aton nga body overcome. But kung amo na nga persist gid siya nang basi may chance nga mag-progress ini. So kung hindi gini siya gadula despite nga ga-hydrate ka or gainom ka na to sa mga juice, ipa-check up ta na lang gid sa aton nga mga sentro kay kisa ang mga uncomplicated lang man nga UTI, hindi man siya need i-test, pwede siya tagaan na lang diretso bulong. Oo.
Ayan. Thank you very much, Doc. So basically kapag laom ninyo, gabalik kita first sa basics, no? So that's why ang program tana bala sa Health and Lifestyle Institute nga New Start. So it will really or will greatly help gid no nga ma-prevent ta before ang mga amo sini nga mga infection mag-abot sa aton, magsulod sa aton nga lawas.
Yes, kaya gusto ko lang i-add no sa discussion ni Dr. nga ang E. coli iting is a bacteria no, so it can also avoid by hand washing.
Yes.
So great prevention gid ang hand washing. So every time nga kapit ka mo sa inyong private part or may ara ka malaktan or something like that, hand washing gid is the best to prevent this infection.
All right. So I think that kumpleto naman ang aton nga mga pamangkot for or nasabat ng aton nga mga pamangkot sini nga episode. Nakita ko wala naman papamangkot sa aton nga mga pages I don't know sa imo dira kapag laom ninyo. Ayan, so I think it's now time to proceed to our spiritual emphasis. But before that, I would also like to ask for Dr. Veles, ang imo doc nga closing statement probably for our viewers. Basta may ara ka pa doc sa idugang or greetings doc.
Tapos naman.
Tapos naman si Doc. Ayan. Thank you very much, Doc, once again for your time, and we are so honored and grateful for your time nga ginhatag
Thank
sa
you also.
The Voice of Health.
Another na lang, Doc, no, if you have contact number sa family.
Okay. So our contact number ang aton nga Adventist nga number 488777, then our local number is sa clinic namon is 366 and amon nga office is 363. So you can call us if you have any questions.
Schedules, Doc, sa
Our clinic is open from 8 o'clock to 5 p.m. Mondays to Fridays.
Yes, thank you very much, Doc, for that information.
All right. So let's proceed now to our spiritual emphasis kapag laom ninyo, no. Before i-share ko ang text no or Bible verse nga makitaan sa 1 Corinthians chapter 6 verses 19 and 20. So it says here, "Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies." So mga kapaglaom no, this text reminds us that ining aton nga lawas, hindi ini aton and ini isang Ginoo, and we're just stewards of this body. So let us take good care of this temple, no? Let us take good care of this temple, especially nga ma-free kita sa mga balatian, infection, just like sang UTI, and paano ina naton mahimo? Of course, pinaagi man sa aton nga mga way of living, practices naton para matitiga naton ang aton nga lawas, because we ought to protect this body because it's not our own. So ginpabaraw lang sa aton, and we have to glorify God by protecting our body free from any diseases and infections.
Yes, kaya sa akon man no, sa Exodus 15:26, if you have your Bible sa inyong balay, and said, "If thou wilt diligently hearken to the voice of the Lord thy God," it means if you listen carefully to the voice of God and will do that which is right in His sight, especially sa aton nga health message subong, if we are doing this, no, and will give ear to His commandments and keep all His statutes, I will put none of these diseases upon thee. So meaning, if you listen to the health message kagina sa aton nga kagina, God will not put any diseases in you, which I have brought upon the Egyptians. Sa una, damo-damo itong mga diseases, no? And for I am the Lord that healeth thee. So, in other words, if we follow this, you may prevent UTI, and also it can also prevent other diseases. And also, see to it nga, let's mind that we are following the Lord. No, we are following the Lord. So, basically, we are pleasing the Lord when we follow this kind of concept. No?
Amen. So,
Amen.
I agree gid sa imo gid hambal kapag laom ninyo. Alright, so madamo gid nga salamat liwat mga kapaglaom sa inyo pag-upod sa amon sining episode. Iniliwat si kapaglaom Marvin nga nagabilin sa inyo sang hambalanon nga have time for your health today to have health for your time tomorrow.
Wow, kaga ako galis kapaglaom ninyo yung gabilin sa inyo, prevention is better than cure.
Magulup danay naman kita sunod nga Lunes live diri sa Hope Channel Bacolod, Hope Channel Central Philippines, Hope Channel Philippines, Adventist Medical Center Bacolod, AWR 360 Bacolod. Ini ang The Voice of Health.
Isa na naman ka topiko ang ato nastoryahan subong nga aga.
Kami nagalaom kag nagapangamuyo nga ini makabulig sa inyo sang dako.
We would love to hear from you, our dear viewers.
For feedback and topic suggestions, call us at 034-488-7777 or visit our Facebook page at Adventist Medical Center Bacolod and send us a message.
Join us again next Monday at 11 in the morning.
Tune in for another informative talk about our body and health.
Because here in The Voice of Health,
We care for you.
The Voice of Health, ang tingog nga mabulig.
Para ikaw mas maging mapagros kag malipayon.